In the anterior view of the overhead squat, we are looking for knee valgus, hip shift, feet flatten, or feet turning out. Cat's feet turning out suggesting overactive muscles such as soleus, lateral gastrocnemius, bicep femoris, short head, and TFL. Underactive muscles such as medial gastrocnemius, glute med, glute max, gracilis, popliteus, and sartorius. Raising the heels, therefore increasing dorsiflexion, will help to identify where the possible dysfunction within the whole kinetic chain is. By excluding range of motion of the ankle, if feet still turn out, it indicates that the tightness must not necessarily be in the triceps surae. Ankle is anatomically best positioned if feet is 7° outwardly rotated. When the feet pass the 10° range, cat starts to lose hip function and her femur starts rotating externally, putting her lower joint at risk of injury, as well as her knees are more vulnerable to the valgus forces. The knee to wall test. Initial position for the weight-bearing lunge. The great toe starts from the wall and the knee is in line with the second toe. The participant is allowed to maintain contact with the wall using 2 fingers from each hand to maintain balance. The heel stays on the floor at all times. 1 centimeter of distance from toe to the wall roughly equals to 3.6 degrees of ankle dorsiflexion. The normative value is between 30 to 50 degrees, or 10 to 12 centimeter is rated as normal. Cat passes the test with the left and right foot. So we can eliminate limited range of motion of dorsiflexion and tightness in the triceps surae. Another suggestion is the overactive TFL. When cat squat, her hip opens up, the femur rotate externally, therefore the TFL and IT band, which originates at the anterior iliac crest and insert at the lateral condyle of tibia via the iliotibial tract, pulls the tibia externally, resulting in turning her feet out. To assess that, we are going to do the Ober's test. The Ober's test is performed to assess for tightness of the ITB and the TFL. Patient should be inside lying with the effect side up. Bottom knee and hip should be flexed. For consistency in testing, top hand and arm to be placed under the flexed knee, holding onto the side of the table. Note the angle of the hip and knee, which should be near 1990. This may allow for better reproduction for future testing. Extend and abduct the hip joint. Slowly lower the leg towards the table, adduct hip until motion is restricted. Ensure that the hip does not internally rotate during the test and the pelvis must be stabilized to maintain position. Proximal hand or hip of the examiner, as the fixation can avoid anterior tilting of the patient's pelvis. The examiner slowly lowers the upper leg. If the ITB is normal, the leg will adduct and the test is called negative. If the ITB is tight, the leg would remain in the abducted position and the test is called positive. We're going to begin by identifying the TFL. The yellow tape at cat's hip marks the ASIS. If you place your hand on the yellow tape and ask her to internally rotate her femur, the TFL pops into your hand. We will position our foam roller right here for the TFL and roll down the IT band lateral of the quad femoris. We're going into a side plank and place the foam roller right there where we identified the TFL. Top leg crossing over for more stability, keeping a neutral spine. We could roll forward and backward to find a tender spot. Whenever we find that tender spot or trigger point, we hold it for 30 seconds. From here, we're going to focus on the IT band by rolling up, and again, once we find a trigger point, we hold for 30 seconds or until the tenderness starts to reduce. For regression, use 2 foam rollers to displace some of the pressure. Standing TFL stretch. Begin in a standing position, external rotate the right leg, step with the left leg forward. From here, engage the right side quadriceps and right side glute. Place your hands on the hips. We're going to posterior pelvic tilt and now bend the left knee and slowly shift your hips forward. You should feel the first point of tension here at the TFL and you're holding the stretch for 30 seconds. Standing with a TheraBand around the knee, hold onto a pole or desk for support, allow band to pull leg into abduction, contract back to adduction, perform with the foot in front of the stance leg, perform 3 sets of 10 repetitions as far as possible provided it is pain-free on each leg. Side lunge. Staying low, take a slow lateral step to the right, keeping your toes pointed forward and stay low. Extend the left knee, driving your weight to the right, flexing the knee and hip into a side lunge. Maintain good posture through the entire spine, keeping your head and chest up. Pause at the bottom of the motion and then extend through the working leg to return to a standing position. The rotary stability test is a complex movement requiring proper neuromuscular coordination and energy transfer from one segment of the body to another through the torso. It assesses multiplane trunk stability during a combined upper and lower extremity motion. If the trunk does not have adequate stability during these activities, kinetic energy will be dispersed, leading to poor performance as well as increased potential for injury. I have also noticed excessive lean in our overhead squat, suggesting overactive muscles such as hip flexor complex, piriformis, abdominal complex including rectus abdominis and external obliques, as well as underactive muscles such as glute max, erector spinae, intrinsic core stabilizers such as TVA, multifidus, internal oblique, as well as the pelvic floor muscles. The athlete stands comfortable on both feet with their hands on their hips and lifts the right leg and places the sole of the right foot against the side of the left kneecap. With the command go, the athlete is to hold this position for as long as possible. Cat was able to hold this position between 10 to 15 seconds, which is rated below average. Begin laying on your back with your hands extended above you towards the ceiling. Bring your feet, knees and hips up to 90 degrees. Exhale hard to bring your ribcage down and flatten your back onto the floor, rotating your pelvis up and squeezing your glutes. Hold this position throughout the movement. Initiate the exercise by extending one leg, straighten the knee and hip to bring the leg just above the ground. Maintain the position of your lumbar and pelvis as you perform the movement. Stay tight and return the working leg to the starting position. Farmer's walks are great exercise for training abdominal complex and intrinsic core stabilizers to create stability in the lumbar pelvic region. Lift the dumbbell, keep your back straight and your head up. Walk taking short, quick steps and don't forget to breathe. Move for a given distance of 10 to 15 meters. After the corrective exercise, the position of cat's feet during the overhead squat movement is now anatomically best positioned between 7 to 10 degrees, increasing the mechanical efficiency to produce maximal force and to prevent injury in weightlifting. Cat's improvement in the rotary stability movement screen is an indication of an increased stability and control in the lumbar pelvic hip complex during lower and upper body limb motion. Continuing and progressing exercise such as dead bug and farmer's walk to focus on intrinsic core stabilizers will minimize the risk for injuries such as back pain as she has experienced in the past. The stork test helped to monitor the development of cat's ability to maintain a state of balance in a static standing position. After the floor test rotary stability movement screen, the retest after 3 weeks improved the results from poor to excellent, meaning standing longer than 30 seconds on one leg.